I worked really hard in school. I wanted to work for the top hospital in my area. I had to go through many, many interviews with them because they really wanted the best of the best nurses. Finally got in, and then day one, I'm put on a different unit than what I was hired onto. And they kind of spun it in a way that I was like, this is this special program, you're doing a nurse residency program. And then in getting to talk with the other nurses, they just said, hey, turnover is too high here. There's no nurses on the floor that you're going to that are able to train you appropriately. Like, they just don't have the time or the experience. So it's just like day one, I was like, red flag. And then from there on, it kept on happening. Like I kept on being put in unsafe situations. They kept on giving me quote unquote promotions where they're like, hey, be a charge nurse, start training new orientees, do this, do that, be on this committee. Those, it came with more work and no more pay, like they were just trying to stretch me as far as possible. But yet they appeal to both nurses and doctors or any healthcare worker. They appeal to your like altruistic personality. They're like, you got into this to help patients, right? Like, you shouldn't care about money. You should just be trying to help as many patients as possible. But yet they never provided us with the resources that we really needed to help patients. So it was just like, it's been coined as moral injury, right? Like, you're trying your best to help in an environment where it's almost impossible to help, and it feels like every day you're in an uphill battle. So that's why nurses, doctors, healthcare workers get burned out so easily. And that's my story too. I got to this point where I had a very potentially dangerous situation happen at work where I was extremely close to unintentionally causing harm to a patient because I was so overworked and overwhelmed, and they had just pushed me past. I had too many patients, way more patients than I was supposed to have. There was just, I didn't have the tools to be able to take care of people well, and it seemed like every day they were giving me less and less to be able to do that.